All right, another one. Treadle DPT, anatomy breakdown, muscle by muscle. They were talking about the Serratus Anterior. Very, very cool muscle. Cool name, cool shape. A lot of cool exercises, so this is one I'm happy to cover. Funny to look back on when I was sort of new to all this. One of my first introductions to the Serratus was like a shadowing experience back when I was undergrad. Walking a patient through a flow sheet, and one of the exercises was SA punches. No clue what it was at the time, but learned from the PT there, went home, did my research. I think from then on, whenever I think of PT muscles, like actual like physical therapy muscles that a PT knows and they love to work with, I definitely think of the Serratus first. So relatively unknown muscle to the general population, but very popular in fitness and clinical settings. Important role in shoulder stability, maybe even more so than other scap stabilizers. So at that point, if you're a clinician, trainer, athlete, or just a fitness enthusiast, this is a muscle that you really need to understand. So let's break it down and see what we've got. The Serratus Anterior is a large, flat muscle that wraps around the side of the rib cage. It sits deep to the scapula, attaching to that anterior surface and connecting it to the thorax. It also lies over the subscapularis anteriorly. You can usually see or palpate the muscle if someone's lean enough. It creates that classic serrated look along the ribs when the arm is elevated, doing those punching or pushing motions. Often referred to as a boxer's muscle or boxing muscle for that reason. Usually very distinct in those lower weight class boxers. So let's get specific. Our origin is going to be the outer surface of the first 8 or 9 ribs. You could actually see a ton of variations here, with some people having attachments to the 10th rib, maybe some people having a lack of attachment to that first rib. But origin on those first 8 or 9 ribs is the most common presentation. It'll run posteriorly and insert onto the anterior surface of the medial border of the scapula. So looking at that line of pull, you can see how it literally pull the scapula snug against the thoracic wall and forward. That orientation we see here is what lets it work its magic with those protraction and upper rotation movements. So just to reiterate, our common SA origin is going to be those first 8 to 9 ribs, and our insertion is going to be that medial border of the anterior scapula. Functionally, the Serratus Anterior is the most critical for that scapular protraction movement. So again, think pushing or punching. It's also a key driver of scapular upward rotation. So without good SA activation, you're not going to get clean, pain-free overhead motion. All of those big scapular stabilizers are really important when it comes to our shoulder biomechanics. So that SA is no exception. Along with its actions in protraction, upper rotation also holds the scapula firmly against the thorax, preventing that scapular winging. When it's weak, you see that classic presentation of the medial border lifting up and off of the ribcage. The Serratus Anterior is innervated by the long thoracic nerve, coming from roots C5, C6, and C7. That's important because this nerve is vulnerable to injury. Trauma, surgical complications, or even prolonged compression can lead to palsy and pronounced scapular winging. We've got a mnemonic that goes C5, C6, C7, raise your wings up to heaven. That should help a little bit. So once again, serratus anterior is innervated by the long thoracic nerve, roots C5, C6, and C7. Clinically, it's not uncommon to see a weak or inhibited serratus anterior, especially in those people with shoulder pain, scapular winging, or poor postural control. It's an underrated but essential piece of that shoulder rehab puzzle, especially in patients with the impingement or rotator cuff issues or any general postural dysfunction. Weakness here leads to poor upper scapular rotation and posterior tilt. You'll also see increased reliance on the upper traps and levator scapulae. So all in all, a good potential for a cascade of compensations in shoulder pain. You'll often see this type of dysfunction in patients struggling with the overhead task or showing those signs of scapular winging. During evaluation, the wall push-up test is one of the most reliable tools for screening SA dysfunction and that scapular winging. So that's one to keep in mind for sure. It's a pretty straightforward test. The patient is literally just doing a push-up against the wall. And while doing that, the clinician is behind them observing the scapular movement. And if there's any winging or dysfunction, there's a good indication that you should be addressing your serratus anterior. When it comes to rehab, very specific SA focus is crucial. We've got EMG studies that point to the push-up plus, serratus punch, dynamic hug, and those wall slides with the resistance bands around your arms being the best high activation exercises for the serratus. So like I mentioned, all the coolest exercises you'd see someone doing in a shoulder rehab program, usually addressing that serratus a little bit. These moves provide strong serratus anterior recruitment while minimizing compensation from those dominant muscles like the pecs or upper traps. So critical for restoring clean scapular mechanics. If you're not training the serratus, you're likely not fixing the shoulder. It's more than just a scapular stabilizer, it's a major key to smooth, healthy shoulder movement, as well as that pain-free overhead function. So make sure you're adding that into your rehab. So that's the serratus anterior, often ignored until it's a problem. But as we now know, hugely important for shoulder health. Also hugely important for shoulder mobility and stability as well. Aesthetically, a very cool, strong-looking muscle. Great marker for peak fitness and attention to detail. So definitely a good one to keep in mind. If you found this breakdown helpful, drop a like, comment, and subscribe for more. Next up, we've got the subclavius, which is much more of an anatomy muscle than a fitness or PT muscle, but definitely worth mentioning. Then we'll hit the pecs, and from there we can branch into the arm and forearm. So much more in store. Thanks for watching. I'm Shuttle DPT. I'll catch you next time.